Welcome everyone to another Expats Portugal video where it is our mission to help you easily find all the information you need about moving to or settling into Portugal. If you're watching us for the first time here on YouTube, please ensure that you click the subscribe button and the bell so that we can alert you every time something new is put up. Joining us tonight as we learn from the healthcare stories of others to help you get the best experience in Portugal. To address this important issue, we're delighted to bring you Dr. Michael Averbuk from Serenity Care to share his professional expertise and real life experiences to help us learn some of the do's and don'ts about the Portuguese health system. Feel free to comment and ask questions in the chat and we'll endeavour to get back to you. If you'd like to be a part of the live audience with these webinars, please ensure you would join us as a member at expatsportugal.com. Now I'm happy to introduce you to the host of our show. Over to you, Carl.
Good evening. Thanks, Astrid. Thank you very much indeed. Good evening, everybody. It's light here at just after 7:30 here in Portugal. Lovely, lighter and warmer evenings to report to you. To those of you tuned in from Scottsdale, I think 2 households in Scottsdale, Arizona, Pittsburgh, Chicago also. Susie in the Airstream. How lovely, camping in the Airstream. Very much looking forward to hearing from Dr. Michael and the team. And there are many of the team here tonight, which is wonderful to see some familiar faces from Team Serenity, who will look after you this evening as well. Charlottesville, Virginia, someone else from Chicago, and aloha from Hawaii tonight. And of course, Estoril, Kashkash. James saying hi, or Jean saying hi to James, and Barack in Texas tonight. Thank you, everybody, for all your lovely greetings and shout outs from your parts of the world. This is definitely one of those subjects where you don't know what you don't know, and it will be illuminating to have a look into many areas, esoteric areas of Portuguese healthcare tonight under the careful leadership of Dr. Michael Averbuk. Michael, you have a do's and don'ts presentation for us to stimulate and start the conversation and bring those questions on.
Thank you so very much, everybody at Expats Portugal. And hi, Team Serenity. Say hi. Say like, do this. Yeah. All right. Thank you very much for the opportunity again. Delighted to be here as always. What we're going to do tonight, and I can start sharing my screen, right?
Please do. Absolutely.
I will.
New York City here as well tonight. While you're doing that, Michael, New York City here this evening as well. Wonderful. Mario, just starting to think about the process. This will be a lot of food for thought for you tonight, Mario, as well. Oh, and Calgary, California. Calgary, Canada, of course. Good evening to you, Connie. Right, back to you, Michael.
Thanks. So what we have prepared tonight is actually a walkthrough, a normal process in a way of moving to Portugal. And what I try to do is on the major steps to bring you some examples. All of it, really all of it, are based off true events that we have experienced. I have changed a bit the quotes and I have changed a bit the stories, but it's all about the same. And the idea is to really tell you what happens, what might happen, what shouldn't happen, and how to overcome those small obstacles, and mainly not to make mistakes. And we chose this topic specifically because of that, because people do make mistakes. And then we get to see the consequences, and we get to see the people in their pain, sometimes a literal pain, sometimes they're just very annoyed and pissed with something that have gone totally wrong and could have gone totally right. And mainly because after hearing all of that, there are simple solutions, and we can really help people, just slide like on a butter into the healthcare system, continue their care without interferences. And this is what we are all about. We just want to make this journey as smooth as possible. As I said before, I'll walk you through the kind of the journey as I imagine it for people that are still on the verge of coming, just thinking about it. Bear with me. So the first quote, actually, that we find quite quite often. Guys, I'm just thinking, I'm about to submit my application, and I know I have asked all my friends, it's gonna be.
Oh, do carry on,
Okay,
Michael.
somebody needs a doctor.
I think so. If you have been hurt there, we are in good hands this evening. Hopefully that wasn't too serious for whoever had that little fall or things fall over in their home. Back to you, Michael.
All right, so this is what we hear. It's gonna be okay. As I said, it's gonna be okay. Somebody fell. So sorry about it. People say it's gonna be okay. I hear the system in Portugal is great. The public care is free. Private care is very affordable. Everything is great. So it's all good. And yes, it's all good. Well, the facts here in this quote are absolutely correct. The system works okay. The public care is free. Private care is affordable. And yet, no, it's not gonna be okay. And the thing is that in terms of transition, in terms of continuum of care, in terms of bringing all your healthcare concerns to Portugal, there are very little impossible transitions. I mean, we have treated so far thousands of cases. We have not encountered one case that we could say just like, don't come. No. Yet, the major thing is plan ahead. And this is the opening statement, and I will end up with that. Plan ahead. And the most important thing is plan your own plan. Because I heard somebody on Facebook told me, everybody says that it's going to be great, and everybody went through it, and it was free of hurdles. It's their experience, and it's not your experience. And remember, please, this is a major opening statement. Plan your own plan and do it ahead. We will get into that in a second. Now, the first thing, so you already thought about it, you understood the system, you have a plan in place. First encounter with the kind of healthcare needs or whatever is your insurance, your medical insurance that you need, or health insurance that you need to provide when applying for your visa, right? And here is the quote, and this is true. Our lawyer said medical insurance is enough for the visa application. Actually, we hear that quite a lot. I'm not arguing with any lawyer. I'm not an immigration lawyer. We're not dealing with immigration. I don't know, but I do know that part of the needs for the applications are actually the standard requisitions of a Schengen visa. And a Schengen visa is not Medish. And if Medish sometimes works, it's great, but it won't work always. We know that sometimes in Portugal, there is a written law or a written instruction, and then everybody does their own interpretation of instructions. But from what we know and what we understand, the needed insurance for your visa application is a travel insurance, which is a very basic product. It's 30 euros coverage, 30,000 euros coverage. You have to have COVID included. You have not to have deductibles. But the main thing and what mainly differs Medish or Allianz or MGen or you name it, Fidelidad insurance from what you need for your visa application is a very simple clause, and this is a clause of evacuation and repatriation. If you don't have that, and you don't have that in Medish, Allianz, wherever, supposedly it's not adequate insurance for your application. Be careful with that. We've seen people that have submitted applications with, again, with some normal insurance from Portugal. It went through. I wouldn't risk it. I wouldn't tell you just go on with that. Another step of insurance, and this is a real life quote. Well, we went to open a bank account. We open a bank account. This is another hurdle nowadays, but we open a bank account, and then the guy at the bank told us, hey guys, you need health insurance, right? And we said, yeah. and it was easy. It was on the spot. It was cheap. And we said, yeah, why not? So he told us, just sign here and here and here and here, and you got yourself an insurance. And we did. And this is one of the biggest mistakes on the way, because you should not just sign here and here and there. Don't do it. Whoever is offering you an insurance, and be it for sure in the bank. By the way, you wouldn't give your money to your insurance broker, so why buy insurance from your money guy? But there's a very simple way to understand if the person in front of you provides you with the right solution of insurance. Ask a simple question. How does this policy that you're offering me serve my needs? Not everybody else's. Why is it good to me? And a good insurance broker would answer this question and would provide you an explanation. Why is policy A or policy B good for you? What does it have that others wouldn't? What are the pros and cons? Like how does your profile fit this product that he proposed to you? And if the person in front of you doesn't have a good answer, don't buy an insurance. By the way, don't buy it immediately. Take it home. Think about it. And here's the thing, nothing in Portugal, for sure not in business, not when you buy something, not when you offer something, not when you look for an apartment, not when you buy a car. Nothing is done in a second. So be Portuguese. It's okay to think about a proposal for a day or two or a week or a month. It's okay. Take it home, take the proposal, ask a broker, ask us, what do we think about it? Does this insurance fit your needs? And if it does, go ahead. If it doesn't, it's not the product for you. So please don't buy insurances in banks in general, or at least ask before. Then you have your insurance, you have your visa, you're on the way, you have the visa approved, all good. Prescription medications. Many people have their prescribed meds in their home countries. And then we come across that. I heard I can have my prescriptions filled. I actually just come with the bottles from the States or with a prescription from my GP in the UK. And I go to a nearby pharmacy and they would fill out my prescriptions. Correct. Actually, yes, but there's a limit to it. I mean, what normally happens in Portugal is that when you go to your pharmacy or to a pharmacy near the place you live, they would help you. Pharmacists here are very helpful, very knowledgeable. They're very much okay. And they would help you with filling out your prescriptions. And even if you brought a bottle from the States, it will be okay, but it will be okay for the first time, maybe the second time, third, fourth. The pharmacists cannot really give you medications, whatever they are, all the time with prescriptions from somewhere else. And now here's the thing. Many people then get worried, how can we have the same medications as we did here? Do they go by the same name? Would I have problems? So I want to reassure you. In the very vast majority of cases, actually, we came across one single medication that is not approved for use in Portugal, actually nowadays two. You will find a substitute, either the same name or a different name. The active ingredient of a medication will be the same. Routine treatments, diabetes, hypertension, cholesterol, all of these are easily, I call it Portugalized. So it's very easy to find it here. It's easy to have a prescription for a Portuguese physician after the first or the second time that the pharmacist helped you. But then you'll have to come up with a Portuguese prescription. But, and here's the but, There are specific meds, not a very long list of them, but very important list of these, that can you see me okay?
Yeah,
Just got a pop-up on the screen. Okay,
no,
sorry.
you're all good, Michael. You're fine.
There are certain meds that are available in Portugal, actually available and even for free in Portugal. But in order to get them, you need to pass through a very specific process. These are biosimilars, for example, injectable materials for rheumatoid arthritis, for multiple sclerosis, for many diseases, actually meds that would cost you thousands of dollars back in your home country, whatever, are given here for free. But you can't even buy them in a pharmacy. If you go to a pharmacy and want to buy a biosimilar, nobody would sell it to you because they are provided for free, but only in public hospitals or in the pharmacies of the public hospitals. Pain management. There are meds that are supervised here. Even if you come with a prescription from your American physician, the GP or whoever, these would not be provided here in Portugal because they are supervised and kind of have a specific way of prescribing it and getting them. So yes, I hear I can have my prescription filled. This is correct, but not all of them, not by the same process. Please ask somebody who understands, ask us or somebody like a professional. How do I get A or B or C? Most probably A and B and C will be very easy. D will be a certain process that needs to be followed through. And this is where people make mistakes. Mm-hmm. Next, I'm coming back to insurance again because it's like, it's a constant issue with insurances. The insurance system here works totally differently. And then we come across many people that say, hey, I'm actually looking for an insurance that would cover for my meds. This is a very obvious concern of somebody, for example, coming from the States. Your major expense and the major coverage of your insurance on a daily in your daily life is for your medications. And then we say, great, but it really doesn't matter because medications practically aren't a game changer when you're looking for insurance. The insurers here would include very small capitals dedicated to medications, and it's kind of marginal. And then people go like, what? How come? And here's the thing, as I said before, it works differently. Medications, for sure, those that are of a big concern in terms of costs, are provided by the SNS, by the National Healthcare System. And just to recap, each and every legal resident, not only a citizen, but rather a resident in Portugal, is eligible for care and eligible for the receipt of medications with a very tiny copayment. So this is great. And then comes the but. The but is the timeline. And here's the thing. There are meds, as I said before, hypertension, something like that. Even if you pay for them for out of pocket, you will get it for a couple of euros. But there are medications that either aren't sold in pharmacies or would be more expensive. They will cost you zero when you have your SNS registration. But between your arrival and the registration with SNS, you might have a long period of time. Today, after arrival, after actually the issuance of visa, you have like 6-8 months until your self-appointment. Correct me, Carl, if I'm wrong. I don't know, like, right? Lately, it's a backlog. I don't know. So we have a long period of time waiting for your self-appointment. You can get your SNS number only after your CEF appointment. So what do you do in between? And this is where we come handy and we say, we guide you towards what to bring with you. Maybe it's better to bring a little bit of a stock. Maybe it's better to understand if you're going to be spending money on medications, if you can even buy them freely, or do you need to follow a certain process? This issue is very, very important. We had people, as I said before, saying, hey, I got insurance, so I got my meds. No, doesn't work like that, not in Portugal. Speaking about meds, so I have very specific medications. I already understand that there's a process involved. And you just said, Michael, bring with you a little bit of a stock. But this meds, I can't bring a stock because nobody would give me a stock in the States or in the UK or in Australia. One, two, they have to be brought chilled or whatever. I just can't. What do I do then? What we normally say is, again, planning is everything. Plan your timing. These medications are specific meds for specific treatments. So plan your arrival or plan your flight immediately after the last course. Be acquainted before coming with what to expect. What is the process? How do we really do it? I gave the example, I think, last time we met, last Thursday, actually, with a client that came here, that arrived hearing all of those good things about the medical system in Portugal and just said, hey, treat me, I'm here. I heard that I can get treatment. Yes, you heard correctly. But you can get treatment, but this process would take us 2 or 3 months to get you to it. And if you just land here and say, hey, I'm here, I have arrived, where's my med? Where are my meds? Might not work so much. So well, sorry. Another thing that we many times advise and help our clients with, you can, under certain circumstances, speed up the process of CEF. This waiting period between your arrival and the CEF appointment. We have done it for quite few clients that with certain approach, with certain assistance from immigration attorneys mainly, you can anticipate your CEF appointment. And having said that, this is a way as well to shorten this period of time between your arrival and the time that you can really be registered with SNS. And another thing, find beforehand the relevant professionals or the relevant clinics. As I said before, some meds would necessitate a specific process in which a very specific physician have to provide you with a very specific prescription. He needs to assist you getting your diagnosis registered with the SNS, etc., etc. Sometimes this process is also time-consuming. So if you plan ahead, if you know where to go, whom to meet, how to do it, it all makes your life easier. There are people arriving with special equipment or very special needed expertise. I'll give you a recent example. People with the most recent example, immunodeficiency syndrome, not HIV related, not AIDS. There are some inborn conditions in which you have a specific medical status and you need very specific medical treatment. And in all Portugal, you have 2 people dealing with this type of disease. Portugal is a small country after all. So if you need this specific one person, you better look for this one person in advance and not after you have arrived here, because he might be busy, he might be on vacation, might take 2 months to schedule an appointment, and all of that is time that you might lose. People that arrive with specific equipment, CPAPs, as an example, sleep apnea, a very popular disease, unfortunately. But without your CPAP, your sleep apnea deteriorates. CPAP is a simple machine, by the way, provided here after you are registered with the SNS, practically for free, including service, including tubing, including everything, but it needs to be planned. If you bring a CPAP to which there are no tubings or masks in Portugal, happens, you're in a problem. Talk to somebody who understands about CPAPs, ask us all the questions, ask us or anyone else that you can find, get ready. Another thing, even more important than CPAPs, insulin pumps. People with type 1 diabetes or people with type 2 diabetes that depend on insulin pumps cannot live practically without the insulin pump. Portugal does not have all the models of all the pumps around the world. Ask what models are available, because you might end up coming with your insulin pump that would not have the proper tubing that you need to replace very often. So please prepare yourself with the special needs, special meds, special equipment. This is majorly important, and the most important thing, we can solve it all. We just need the time and the knowledge that, hey, I have this special need, including, again, a helping hand with language, providing you with the right background, providing the prescribing physician with the right background. Imagine that this only physician, the only one physician in Portugal that deals with exactly what you have, doesn't speak English. Then what? All of these things have to be planned ahead, understood ahead of time, and then solved, and we can solve them all. Just talk to us. Here's another thing. This is quite popular. So I'm here. I have my SNS number. Great. I bought a great insurance, but with all due respect, I'm going here, I'm going there. I can't find a doctor that I need / I like. So I have here Mr. What's his name? Shepherd, Dr. Shepherd, McDreamy, Dr. McDreamy.
Yes.
So I can't find this one. All right. So spoiler alert, is not in Portugal. But here's the thing. Whether you have SNS or you're eligible to the public care, or you have an insurance, you need to understand how the system works here. And here's the story, and this is a true story as well. So I have SNS, great, and I decided that I want to go and perform my total knee replacement through the public sector. Somebody told me that it all works well here and it's for free. All right. So how do I get, just understand the process, how do I get my knee replaced through the national healthcare system? You need to go to an operating orthopedist, right? You need to go to somebody that will operate on your knee. In order to get to a specialist in the public sector, you need to have a referral from your GP, from your primary care physician in Posto de Saúde, in the community healthcare center near the place you live. You go there, say, hello, here's my SNS number. I want to see a doctor. They tell you, sorry, we don't have available physicians. We do not accept newcomers. So, okay, but I need to see a doctor. They tell you, all right, great. So you can go to a regional center. They will accept you there. They are bigger. You go to the regional center. They are bigger. You come, there's much more people around. Say, hello, I came. I need to see a doctor. Say, well, we don't have a doctor to assign to you. So, but I need to see a doctor. Then they tell you, great. You can see a doctor on the days that we have open house. Okay, when is that? The day after tomorrow. How do I get there? Oh, you come in the morning and whoever is available will see you. Great. You come in the morning the day afterwards. It's 8:30. They open at 8, let's say, whatever. 8:30, sorry. Today, we're fully booked. So how come? You just opened. Yes, but we open at 7:30 when we provide you with the numbers. So what should I do? You come the next open house day, 7:30, get the number. Great. You come the next day, open house day, get a number, 7:30. By the way, 7:30, they started disbursing the numbers, or at 8, at 7:35 or 8:05, you don't have numbers anymore. You got a number, you're lucky. You go to see a physician, you say, doctor, I have a bad knee, I need to be seen by an orthopedic surgeon. He says, great, here's your referral. Okay, where do I go? We got it treated. You will get a call from your public hospital to which you belong. They will call you and tell you when to come. All right, so what do? Nothing. You stay at home, you wait. Wait actually is a good word in Portugal. Wait, you go home and you wait. Another spoiler, 25%, this is official data, 25% of those processes of internal referrals never happen because something is lost in the limbo between the systems. But hey, you got lucky and you got a call from the hospital that you belong to. There's only one hospital that you belong to. They will call you. You got a call. Hello, sir. Imagine that you even understood what they said to you, or they speak English. Say, okay, you have an appointment with your orthopedic surgeon. Great. When? Well, today is March 30, July 15. This is true. I'm not lying. July 15. Said, wow, but I need to see him. Yeah, but it's not urgent, right? Yeah, I can still walk. Okay, July 15, you come to the doctor. Imagine that there's no delays. The doctor is not on vacation. You come to the doctor. Imagine even that he speaks English. That would not happen because you cannot choose a physician in a public sector. You're going to whoever you're assigned to. You're going to the doctor. He looks at your knee, looks at your x-rays if you have them, and he says, yeah, Mr. Smith, you really need a knee replacement. I can operate you. You're very happy. You say, great. When can I come? He opens his books. Well, it's July 2023, August 24. 24, I mean, not August 24, the day, August 24, the year. And you will wait. And 1 year waiting for a total knee replacement is good. So, guys, this is the true picture of how the public system works. The thing in the private system, it works much better, much faster, much more efficient. There's only one thing that is missing. Actually, in a private sector, having a good insurance, and we said here, I have a good insurance in place. When you have a good insurance in place, you can actually go wherever you want. And here comes the other side of the same problem. I know I need a knee replacement. Where do I go? You open a list and you have 20 orthopedic surgeons in Kuf, another 10 in Luz, another 15 in Lusíadas. Who do you go to? The system in Portugal, both public and private, misses this one pivot person that is your case manager. Normally, it would be your primary care physician. As you don't have primary care physician in the public sector, I already told you the story, and you almost don't have them in the private sector as well, somebody that really knows you and understands your needs, you're again in a bit of a limbo. Where do I go? Who's a good surgeon? Like, who does speak English? Who is kind of, I can trust him enough to go and do it? And don't go to the orthopedic surgeon who just did a great shoulder surgery on your neighbor, because shoulders and knees aren't the same. What you need is to get a good referral from somebody who understands your needs. And here's the thing, again, this is part of the issue of Portugal. Not a lot of pivotal professionals that can really assist you. We can, but again, if it's not us, find somebody that you can really trust, a primary care physician that will understand your needs, that will have enough network of providers that he can refer you to, and go there. Don't do it alone. Oops, sorry. I'm coming to the end. I don't have a lot of time, right?
Correct.
Okay. Another small thing that we have came across interesting, and I think that it started showing around only when expats starting to be more and more. You should not, I repeat, you should not pay money or a lot of money unless you really go private to a private clinic or a hospital and you don't have insurance and you don't have anything else. For sure, a public clinic should not ask you for money. They're not supposed to, they're not allowed to. Okay? Unless, again, you go to a public hospital without a referral, without SNS number, and you go to the emergency room, they might charge you some fee. Otherwise, no money in the public sector. Do not pay money if you go to a private clinic, you have insurance, and they just tell you, no problem, we'll take care of your insurance later, but in the meantime, you have to pay us for the treatment. No, you have to pay a co-payment. Sometimes you have to pay for a treatment a discounted price if you're on a waiting period with your insurer. But to pay in parallel, and this they do it a lot. They tell you, all right, so hi, hello, how are you? Blah, blah, blah. Where's your insurance card? Here it is. We need your credit card as well. Do you have a credit card? And they kind of pass it like in a hotel. So guys, this is not a hotel. You're not paying here for extras. Because what really happens on the background, or what might happen on the background, is a very simple process. You have insurance. It's, I don't know what, it's 3 a.m. The platform of insurance didn't work. It didn't pass. I don't know what, something, a simple technicality. The clerk in a private hospital would forever prefer to charge your visa. And sometimes those charges on your visa are more than 120 euros, more than 1,000 euros. Sometimes if you come as a private client to a private hospital and you went through the ER and you need to be hospitalized and you have insurance, but they didn't contact the insurance for whatever reason, they can charge you up to several thousands of euros just as a deposit for your stay. Please pay attention to this. Okay. And another thing, there are no kind of urgent needs or urgent need fees or whatever. If you're calling somebody and there's an urgency in your appointment request, they shouldn't charge you for urgent needs or urgent appointments. The only urgent thing that you pay is when you go to the emergency room. And again, all of that can be prevented if you know the system, understand the system, or work with somebody that can walk you through it. My last slide, and you can stop recording. If you could take only one single slide with you, this is the one. I promise to end up with the same message. Plan ahead. This will prevent a lot of mistakes. This will prevent a lot of stepping into pitfalls that you shouldn't be walking on. Please plan ahead. When looking for information, Facebook is great, Instagram is great, whatever, but please go to verified sources. Expats Portugal is one of them, for example, or other sources and platforms that you can really trust, that you have kind of a track record of people that say, hey, we've been there and this platform provides us with a great information. So do this. Insurance, whatever insurance in terms of healthcare, of course you do, see that it fits your needs, your specific needs. Ask the question, how does this plan serve me? Not that it's the best one. The bank sells thousands of these. Great. You're not another number of 1,000. You are you. You need your plans and your needs to be addressed. Continuum of care. Again, I'm not, of course, diabetes, hypertension, you name it, is very, very important to take care of. But there are medical situations in which stopping a care is not an option. Verify, please. How do you do it? What are the processes? Does it take a week or does it take a month? Does it take 3 months? Where do I go? How do I do it? Again, plan ahead. And last, before calling Serenity, actually, the last one is called Serenity, but before that, be critical, be politely critical. I'm telling you, and by the way, this is in everything in Portugal. I told you, and I'm telling you again, and people that are here for a long period of time would probably tell that I'm correct. I said in Portugal there are written laws, written regulations, written whatever, and then many people have their own interpretation. And if something doesn't make sense to you, I know that you are polite people, you're in a new country, maybe it works here different, but believe me, if it doesn't make sense, it doesn't make sense. So be politely critical. Ask, oh, okay, thank you. Why? Why didn't you call, like, why are you charging my visa in the emergency room? I have an insurance card. Did you call the insurance? Ah, yeah, but they are not answering. Okay, but this is not my problem. Okay, or like you're going somewhere to get a shot in a public clinic and they say, ah, you owe us 50 euros. Why? For what? Well, like, be critical. Don't accept everything that is said. It's okay. You don't have to create a mess, but at least ask why, ask for an explanation. It's very much okay. And sometimes this small pushback will prevent you from, I don't know, from losing time, losing money, losing whatever, or just call Serenity.
Excellent, Michael.
That's it.
That's wonderful. Thank you so much. And now, given the complexity of the situation you're coming into, understandably comprehensive and in depth there, and we'll do our best now to unpack things a little. If you need any further clarification, now's the time that we'll do that. So thank you so much, Dr. Michael, so far. We'll do about 10 or 15 minutes of questions that I think will be of universal use. And then if you feel more comfortable asking your questions after we stop the recording, have that wait of 10 or 15 minutes and you'll be able to then talk directly to Dr. Michael and the team. So wonderful stuff. Let's see you back on the screen there, Michael, if you want to end your screen.
Yep.
Right.
Here we are.
There you go. That's fantastic. Thank you, everybody, for your questions. We're going to start with a testimonial, basically, from Tom in Lagos. I'm a Serenity client, and they are incredible. How about that? Helped me through a sudden need for surgery after a sporting injury. That's some kind of retirement. If you are indeed retired in Portugal, there, Tom, dramatic, but Serenity coming to the rescue, fantastic. There was some confusion, Michael, about the insurance that's needed for the D7 process and the insurance that comes after. So perhaps you could make that distinction for us. You need a very specific type of insurance policy that includes a repatriation and other features to basically not make you a burden on the system while you're here.
Yeah, and again, please, I'm telling you what we know. If somebody comes in with a different recommendation from an immigration lawyer, and this is what the lawyer says, and you will pass it with something else, go ahead, be my guest. Yeah, what we know is a very simple and very logical issue. When you apply for the visa, you apply actually for a Schengen visa. Schengen visa, when you open Schengen visa on Google, there are a very specific request of a travel insurance that is relatively simple. 30,000 euros coverage, COVID coverage since COVID, no deductibles, but there's this issue of evacuation and repatriation in it. The logic behind it is that if you arrive to a new country, to Schengen, from a non-Schengen area, and something bad happens, you're covered by this insurance to fly you back to your home country. Even makes sense. And this, as far as we know, is the requisition upon application. Now, the thing is that if you apply with an insurance that you bought in Portugal, whatever be it, the top tier, you paid, I don't know, thousands of euros, great. But local insurances would not have is this repatriation clause, because you're buying an insurance for you to stay in Portugal. Where will they fly you to? So they don't have this evacuation repatriation clause, and hence, whatever the insurance is, the best of the best, it might not fit those basic requisitions of the simple travel insurance for the visa application.
Thank you for that. So Michael, sorry.
What we know, and if your lawyer says different and he gets you the visa, great.
Yeah, because there is a level of interpretation, but that's a really good distinction. Thank you for making that clear. If you are shopping around for insurance, you may be interested to know that Nuno is here tonight from Insurance, who has a policy.
Here's Nuno. Hello.
Nuno is here, and he has a policy specifically for that purpose, which we know works. So that again takes a lot of the stress and not knowing out of a situation. Nuno, feel free to chip in, make yourself known to everybody. But thank you. I think that should help Havli, Ken, Gail, who are asking for clarification. Then, of course, when we finish the recording, we can seek further clarification and make sure that you feel comfortable with the information for all of you. Thank you very much to Jean for the question. Are preventative services available through the National Health System, mammograms, colonoscopies, etc.?
Yes, but again, the thing is, this is maybe a good point to make this distinction. The public sector, as I said before, free of charge, all good, and yes, colonoscopies, preventative measures, mammos are available. The big thing is that you need to get to a physician that will give you the referral, and then to wait to perform the exams, again, through a public facility. Actually, if we have the time and we're not in a rush, I have here at least 4 great nurses, our case managers, that live it. This is their daily life. I can talk, blah, blah, do presentations, but they are the ones fighting for your colonoscopy, as funny as it sounds, both in public and private sectors.
There you go. So people fighting on your behalf, and that's a really important piece of information here. When I was making notes about what you were saying, there were four things that really stood out for me. One is the point that you made about people are coming to a very different culture, and that's something you need to get your head around and not make assumptions, because those assumptions can be painful and stressful. You need to allow time as well, and you need to be very bespoke and personal about this, and make sure that the services that are being offered to you and that you engage with are very individual. And the last one, that you need somebody mediating on your behalf. And that is exactly what Serenity do. And as Michael's saying, Dr. Michael is saying, the team, the case managers here, will be doing that for you on your behalf, which I think others who might wish to say, talk about their relationship with you here, clients of yours, I think that's probably the key and most important thing that people say about you in the most positive of ways, is how this advocacy and case management works on people's behalves when they are in a new country, in a system they don't really understand, that might be very different to the one they've come from. So well done, team. We might get to speak to a few of them this evening as well. Barak asked a question. So if you take a medication for cholesterol, for example, and you have a 90-day supply, how can we get it filled if we have not had our CEF appointment? Is this one of those prescriptions you can go to the pharmacy with a bottle and get a refill and hope we get our appointment within 120 days? The timing here, Michael, what was your experience of that with people?
So this is actually, again, when we talk about the routine meds, it's very simple to get it filled, because you go to a simple consultation with a GP, either a GP that we found for you or you found alone, or with a GP that we can acquaint you with, even for an online consultation, that understands your background. Okay, you're a person of a certain age that takes cholesterol or high blood pressure meds for the last 10 years. Your last meds are A, B, and C this is the name in the States. We have the same here. Here is your prescription. The only difference that at this stage will happen is that those prescriptions will be bought for full price of meds. These kinds of meds is not a big one in Portugal. So in a matter of, I don't know, 10, 20, 30 euros, you're done.
Okay.
Okay.
So again, that's why it's worth starting a conversation with you to find out specifically with the particular types of medications people are on, whether they are available in Portugal. Thank you for that question, Barak. That's great. And let me, the questions are moving around as people answer them. And I know the Team Serenity have been getting busy answering questions behind the scenes here. So I'm very grateful for that. Rolf asked the question about dental treatment. Why don't we roll into that? These are sort of ancillary services and how that works in Portugal. Let's bring optometry into that, ophthalmology and
eye care. Yeah, eye care and dental. Actually, thank you for that. I didn't include it, forgot, but yeah, it's a very common question. So these are covered in the following way. Practically, dental care is in reality private, all private in Portugal. 1, 2, it is covered to a certain extent within your healthcare policy. The policies would differ, of course. Some would cover a bit more of a capital, would dedicate a bigger capital to a dental plan. Some would dedicate lesser capital. All would practically provide you with an access to a network of providers with discounted prices in general. Okay, of course, again, there are differences between top tier, middle tier, low tier plans, and I'm talking dental. There are some dental top-ups or add-ons with different providers. Each and every one of them gives you a bit of a larger benefit. But remember that for bigger interventions, orthodontics, implants, etc., you will probably end up paying out of pocket. And again, the price depends where you go. There are clinics that are very expensive, clinics that are less expensive, clinics that work with insurances, don't work with insurances. This is dental coverage. Vision and eye care. Everything that can be done by an ophthalmologist, even the visual acuity test or something like that, is covered within your health plan through the outpatient coverage. Actually, you go as an outpatient to a clinic where an ophthalmologist sits, your insurance will pay for that. Everything that is frames, lenses, etc., normally, again, would be to a certain extent part of your health insurance. Again, with a difference between the insurers in terms of capitals, in terms of network of providers that would give you some discounts, etc. This is how it works.
Thank you, Dr. Michael. Just a couple more then, and then we'll end the recording so you can ask your more personal questions. Good question from David. General question. Does the medical system rely on general practitioners as the first stop for care and additional services? Now, you did make some reference to this and the complexities, but in principle, that is how it works. People would start with their local health centre, would they not?
If you want to go through the public sector, you practically have to start with a primary care physician. And this is part of the problems because they aren't available. The system is overwhelmed. Yeah. So you can't even start your journey. So this is a major obstacle on the part of the public sector. In the private, as I said, and I'll emphasize it again. When you have a private insurance, or you just want to use money, you want to use your Visa card for a change, you can go to whoever you want. You don't need a referral to go to a neurosurgeon if you want.
Yeah.
Okay? And again, here's this other part of the same problem, because people are just going to whoever they want, necessary, unnecessary, before they did any kind of a preparation. You lose time, you lose money, you lose focus. When you, in my perspective, by the way, there's another issue of private primary care. In many cases, you have here at least 4 people to testify, the nurses. In many cases, you refer a client to a primary care physician in a private sector. And many times, because of the nature of work they do, they treat you as a walk-in. Actually, you just walk in, you have a certain problem right now, I'll solve it, and let's move on. Mm-hmm. Many times, our case managers have to insist with our clients that, hey, I'm referring you to a primary care physician. He's a doctor that works in a private clinic. He works in a private hospital. When you go there, specifically, we know that he's nice, etc., etc. But if you see that there's chemistry, please emphasize to this physician that you really want to establish here a relationship. It's not like you walked by and you just need a prescription. No, you really need a primary care physician to whom you can return. That would kind of lead you through the process, follow up on you, do your annuals, take care of your blood pressure or your diabetes. And I feel there's a problem because otherwise, those very good physicians, by the way, would just treat you as, hello, what do you have today? A, B, C, D. Okay, thank you very much. Here are your prescriptions. Bye.
So they wouldn't take that holistic approach, and that's what you should invite. So there you go, David. Thank you for asking that question. That was a really good inroad to getting the best possible care as well. A couple of quickies then, Michael, before we turn the recording off and talk to people behind the scenes and get to their specific questions that they may not want to ask in public. But Gail Giles asked, this is a good one and may be of a universal benefit. Does Serenity replace the PCP we use in the US? That's a reference point for people. Yeah, just tell me, what is PCP? Primary care physician. I'm guessing so, yes. If it's a primary care physician, to a certain extent, yes. Okay. Where do we come handy, actually? One, those very professional case managers know what they're doing. All of them are nurses, all of them are very experienced, so they can really case manage or manage the case or manage you as a client in terms of your needs today, your needs tomorrow, your preventative care, everything that your primary care physician would do in terms of management, referrals, what should you do first, what should you do next. And more than that, to a certain extent, we have the ability, not to a certain extent, the ability is there. Not everyone can fit this ability, but we can assist you with either our own physicians. Speaking of such, we started our own service of primary care in Lisbon, in Serenity. So we can assist you with our own physician that comes already with this set of mind that, hey, I'm your primary care physician. I'm your PCP here. You're not just, this is not an urgent care. So in Lisbon, we can do it, okay? But even if you're not in Lisbon, you're in Porto, you're in whatever, we can either acquaint you with somebody that already understands our set of mind, or help you with our physicians, even with an online consultation. There you go, Gail. Fantastic. That acronym, PCP, is primary care physician. A couple of others. SNS, that's been mentioned a lot. That is the health number, sometimes known as the UTENT. And when Michael mentioned CUF and LUJ, they are private hospital services, CUF and LUZ or LUZ for some people. Just finally then, before we finish before we press the button and stop the recording here, Michael, just briefly, please, average costs of your service. Somebody asked earlier on, do they need a separate membership? Is there a household membership? How much does this cost and how does it work? Our service is the basic medical concierge and case management package is at a very symbolic price of 225 euros per person per year. So it's less than 20 euros per month, guys. It's worth the money, believe me. There you go. I'm sure a lot of people will agree with you. We'll leave the recording there for the time being and we'll go to those more personal questions. Michael, for the time being, thank you very much. And Nunu, who's been working behind the scenes from Winsurance, and Team Serenity, who I know have been doing a lot of great work behind the scenes. We'll leave it there for now. Thank you so much for your presentation and for answering those questions.